what I'm going to do is just kind of go through really quick what our unit is, who we are, and the work that we do, because the work we do is a little bit different than what others in the division are doing. And so this is just to provide a little context and a little understanding about who we are and what we do. So first I'm going to talk about the unit, and then as a whole, and then I'm going to talk about the individuals who make up the unit. And we're a very small unit, so there's only 4 of us. Anyway, so who we are and what we do. Oops, can't do that. I'll do this. All right, so the objectives are, I'm just going to do an overview of the Forensic Special Initiatives Unit, and then also our collaboration, our recent collaboration with the Georgia Bureau of Investigation to create the CADE task force, talk a little bit about that. And then, like I said, I'm going to do just an overview of the forensic specialists that make up the unit, which is the heart of the work that we do, are the people. So the unit. Again, there's 4 of us. I started in 2006, and at the time my marching orders were to try to build a bridge between adult protective services and law enforcement. I'm also, in addition to being a forensic nurse, post-certified investigator and an officer in the domestic violence unit in Gwinnett. And so just given those 2 things, being an officer and very interested in elder abuse and a forensic nurse, those were my marching orders to build a bridge to law enforcement. David Blake came on in 2010, and so then it was up to build steel bridges to law enforcement. So for those of you who've attended the ACT training early on, well, even now really, the focus has always been more on the criminal justice. I mean, it's multidisciplinary. We want anybody and everybody who is a primary or secondary responder to attend, but the emphasis has always been more on the criminal justice components of abuse, neglect, and exploitation. So we're starting to broaden that. I'm going to talk a little bit more about some of the other initiatives we've got going. Anna Thomas came on in 2016, and she also is post-certified. David, Anna, and I, all 3 of us are post-certified as, or were, as peace officers in Georgia. And Anna and I both worked in prosecutor's office. And so her background was not only an investigator, but she had also worked as a victim advocate. And so she really wanted to kind of start beefing up the victim portion of the resources for adults who have been victims of elder abuse. Social services and regulatory services we've got covered, but not so much the victim services. And there are a lot of victim services that can be available to older adults and adults with disabilities. Shawanda Wright is our newest member. She just came on in December, but she's a veteran of not only Child Protective Services, but Adult Protective Services. So we stole her from Adult Protective Services just because of the leadership that she had demonstrated as a supervisor, just her wealth of knowledge. And so together, the 4 of us make up the unit, and we cover the entire state. So our goal is to support those who are doing the frontline work, those who have boots on the ground. And we do that through training. We have lots of different training initiatives. We do a lot of technical assistance and case reviews. I just went out last week and met with some detectives on a fatal neglect case. And David gets a lot of case reviews related to financial crimes. So, but then we also do a lot of collaboration, again, because we're such a small unit and the work is huge. You can't do this work without collaborating and networking with a lot of other individuals. So what we try to do is identify gaps in the systems and then try to address that through policy changes. And so I'll talk about all this as we go. So that's the unit. Aren't we a good looking group? So in February of this year, the MOU was signed. It became official that we were now part of the GBI's Crimes Against Disabled Adults and Elderly, or CADE. That's a unit that had been in place since 2015 or 2016. And so it was to create the task force to improve and expand the response to abuse, neglect, exploitation. So behind the scenes, this is just something I want you to consider. Excuse me, I'm so sorry. An older adult's brought to the ER by ambulance with infected bed sores and signs of malnutrition and dehydration. So the question then becomes, who are the primary responders in this incident or similar situations? It's going to be law enforcement if they're notified. It's going to be EMS if they're notified. Well, obviously they were because they're the ones brought her to the ER, but then also the ER folks. At this point, it's not Adult Protective Services because they will tell you they are not first responders. So the primary responders are those people that are going to immediately respond, and that includes dispatch operators as well. And so then the question for those folks is, what are the immediate abuse, neglect, and exploitation issues, concerns that you might have? And also, what are the obstacles? So those are the things that we want to know about. What are the issues and concerns? And issues are so important, I put them in there twice. But we want to know what issues and concerns, and most importantly, what obstacles are being encountered, so that we can figure out maybe ways to address those obstacles, especially as it relates to victim safety. And then the same thing is, who are the secondary responders? That now is like Adult Protective Services, regulatory folks. Pretty much if a 911 call is made, whoever's going to touch that individual, the potential victim, from the time the 911 call is made until that case either goes to court, if it's a criminal case, goes to civil court, if it's a civil matter, or maybe it doesn't rise to the level of a crime, but the person needs resources and so forth. Anybody that touches that victim is either a primary or secondary responder. So with a secondary responder, same things. We want to know what issues and concerns are there for them, and then also what obstacles, because those are the kinds of things that we try to address. So that's kind of where we work, is sort of behind the scenes, trying to improve the system. But I can tell you, sometimes it's just really hard changing, federal statutes, state statutes. It just can be very difficult. So this is kind of a timeline. Again, I was hired in 2006 to develop this bridge between law enforcement and Adult Protective Services. David came on in 2010 to develop the financial exploitation focus. In 2012, we had a serious incident review team coordinator hired, and this also shows the evolution of this unit. This is new, it's unique. I don't think any other state units on aging have a unit like ours. And so this just sort of shows you the growth of the and evolution of the unit. In 2016, Anna was hired to develop the special victims focus. And in 2017, we had the temporary emergency relocation fund coordinator was hired, and they did such a good job. Then, this grant came in, and that was turned over to APS for their CJCC unit. In 2020, Shawanda was hired to develop this APS liaison focus, just so that we make sure we're always on the same page, that we have really good communication, not only between APS, but she's also sort of evolving into being an APS liaison between law enforcement, between healthcare providers, between a lot of different individuals. And then in 2021, the CADE task force was created. So that's just a real down and dirty timeline of the unit. So these are some of the training courses that we offer, and we've got some that are actually in development based on some recent conversations. We have ACT, that's the one, we started that one in 2011, so it's been around the longest. And that's the At-Risk Adult Crime Tactics certification course. And in that one, again, like I said earlier, the focus is more sort of on the criminal justice group, and it's a 2-day virtual boot camp now. REACT is just a name we came up with for the mandated reporters. It's a monthly 1-hour abuse, neglect, and exploitation overview, and then also an overview of mandated reporting. That just occurred this morning. It's virtual as well, and again, that's targeting any and all mandated reporters. If you don't know if you're a mandated reporter, if you're required to report child abuse, you're also required to report abuse, neglect, and exploitation of older adults and adults with disabilities. Then we've got FACT, which is a 1 to 2 hour. It's sort of like REACT, but it's focused really more on facility staff and administrators, and that one's by invitation when it's requested. We also have IMPACT, which is informing multidisciplinary practices on adult abuse concepts and trends. Excuse me, I'm so sorry. Again, we started out with a focus on criminal justice, but we soon realized, it's sort of a cascading effect of who really needs to be trained. And so certainly clinicians, healthcare providers desperately need this information, and they've told me that. So we created Impact, and it's really focused on clinicians. And so we talk about ethical issues, legal issues, person-centered care, trauma-informed care, that sort of thing. So again, it's really focused on healthcare providers pre-hospital and post-admission. So it's good for EMS folks as well. And then we've got Reenact, which is training that we do monthly, live and or virtual, for the Georgia Coroners Association. We had the privilege to be accepted and do training for them last year, and then we were accepted again for this year's in-service training for their association. In fact, I'm leaving Monday to go down to Jekyll to do a training for them for their I guess it's for their April training. Coordination or collaboration, both. This is just a picture taken at one of our statewide abuse, neglect, exploitation work groups, which has been around since 2012. And one subgroup of this group is the legislative work group. And I'll show you in just a minute that work group has been very successful in changing policy. And it is ongoing today. We've also got the financial work group, which was established in 2015. David Blake started that. It's ongoing. I think he's up to about 400 members, and that's primarily financial institutions, adult protective services, law enforcement. But anybody's welcome. We have a multidisciplinary team liaison that was established in 2018 with the passage of the bill that created the multidisciplinary elder abuse team. So Anna is our liaison and works with all the different teams. And then, like I say, in 2020, Shawanda came on board to be the APS PGO, the public guardianship liaison, not only for our unit, but also, like I say, with a lot of other external entities as well. And that's ongoing. So these are just some of the highlights from the A&E working group. In 2011, unlicensed personal care homes sort of came on the radar. We collected data, presented it to the then director of the GBI, Director Keenan, and he called for a meeting in 2012 and wanted to know, everybody, what were the obstacles that you face in doing this work? And from that, he created an executive summary that went to the governor, but it also became the checklist from which we started working to address those obstacles. So 2013 was probably the biggest one of the biggest things that we did at that time, and that was just massively change the official code of Georgia, which is the Georgia statutes. So we created, there's now crimes in criminal statutes that address abuse, neglect, and exploitation, and that happened because of House Bill 78. We also did one-day training seminar, just basic abuse, neglect, exploitation. In 2014, there was a joint study committee about emergency relocations out of that. In 2015 came House Bill 744, which was a temporary emergency relocation fund, which is now used to do the TURF, some of the TURF assistance. The GBI at-risk adult, the CADE unit, was essentially created in 2015, and they brought on the assistant special agent in charge, Heather Strickland, who is still over that unit and is now, a partner with us with CADE. In 2016, Heather and I traveled to meet with the Department of Justice, HHS, and Social Security Administration about unlicensed personal care homes. They kept calling it healthcare fraud when it was not, and they clearly got that. Trying to educate them. We're trying to educate them because we need funding to assist victims of this benefits trafficking, which we're seeing so much of, but it doesn't quite fit under the current definitions, federal definitions for human trafficking. So it's one of the reasons we're trying to educate them. 2017, PAC, the Prosecuting Attorneys Council, brought on an abuse, neglect, exploitation prosecutor with statewide authority. That's Will Johnson. Some of you might have heard him if you've been to ACT. So he can help any prosecutor in the state if they need assistance with an elder abuse case. And then in 2017, a ACT specialist with the GBI was identified in each of the 15 regional offices. So they have an ACT specialist in all of their regional offices to this day. 2018 created the court district multidisciplinary teams, and then also benefits trafficking was identified as a felony. 2019, we did an elder abuse presentation to a conference that was here in Atlanta of the forensic pathologists, again, trying to get them to sort of stop and start looking a little closer at older adults when they die. Just because you're older and have pre-existing conditions does not automatically make it a natural death. 2020, we had our 100th at-risk adult crime tactics class, and because of COVID, it forced us to create the virtual version of ACT, which we'd been talking about doing for years, but COVID made us do it. 2021, we had House Bill 363, which passed. I don't know if the governor signed it yet or not. I guess he will. Where we had to clean up the statutes a little bit. If in the law, if there's a crime and it's charged as a felony, but there's also a crime that is also a misdemeanor, that the court's always going to defer to the misdemeanor. So we got rid of those misdemeanors. So now if you get charged with elder abuse, they're not going to be able to reduce it down to simple battery or battery of an elderly. And then also the creation of the task force. So those are just some things that have occurred since 2012. Technical assistance, this used to be our wall of shame. So these were cases that we had touched at some point. Sometimes we don't always know what the outcome is because we might have a very small piece of the technical assistance. It might just be, hooking a law enforcement officer up with, who they need to talk to in APS or over at the regulatory, over at HFR. So sometimes we wouldn't know about it until maybe an article came out in the paper. But we do technical assistance, all four of us do, as requested by any state, local, or federal entity, local and state law enforcement, prosecutors, coroners, medical examiners, basically whoever asks us, we will try to assist them. So let's talk really quick about the people, and I think I'm good on time. So if you can, just show with your raised hands if you can do that. Has anyone experienced a case or been involved in a case that involved physical abuse, sexual assault, strangulation, non-fatal or fatal, financial exploitation, neglect, non-fatal and or fatal, suspicious death, or multidisciplinary teams? I see one person, two people, three people, four people have raised their hands. So 6, 7. I would imagine just about everybody probably in the division has either, if not in professional, maybe personally, somebody, professionally, if you're doing INR, I would imagine just about everybody has probably even either heard of or been involved in a case. And so if that's the case, then hopefully FSIU may be able to assist, because this is kind of, our wheelhouse. This is what we do. So again, I am a former trauma nurse. I know y'all think, well, she just causes trauma or drama, but I'm a trauma nurse. I worked at Grady at Piedmont and St. Joe's in their open heart unit, and also spent some time as a legal nurse consultant working in a medical malpractice defense firm. Post-certified officer and investigator for the Gwinnett Solicitors DV and Elder Abuse Unit, and also a post-certified instructor. And then also a forensic nurse with 20 years experience in at-risk adult abuse, neglect, and exploitation. So for me, my areas of interest, the things that I really am gravitating towards are what is a suspicious death, and then also trauma, but in the context of disability and aging. One thing people may not understand about older adults is just a total lack of reserves. And so things that a 30 or 40 or 50-year-old can, get through and get past might not be something that an 80 or 90-year-old can get through and past because of a lack of reserves. And that includes, finding out that they've been totally exploited and are now facing financial ruin because of it. So those two are really of interest to me. And I've gone back to school. For those of you who are currently in school or have gotten your master's, God bless you, because I'm back in there too, trying to get a master's in forensic nursing. So my role, I manage the unit. I do a lot of training. Again, my audience is a little more targeted now for healthcare, for EMS, for coroners, and medical examiners. Technical assistance, again, is requested pretty much by anybody, but the requests that I get mostly come from the coroners. I get a daily spreadsheet now from the GBI, so I can look at the decedents that are coming to the GBI or that are headed to the GBI to check to see if there's history with APS, because that might change the whole trajectory of that case and how that case is handled. Work groups is the statewide A&E group and also the legislative work group, and then also on a subject matter of interest for the Academy of Forensic Nurses. In fact, I just got off a call with them before I came here. Again, technical assistance involving any kind of physical abuse, neglect, suspicious deaths. And then the presentations that I do is impact or a version thereof, and for coroners in healthcare. David Blake, 30 years law enforcement with DeKalb PD, and then also he spent 8 years with Jean Canavan, who's probably she's been doing these cases longer than anybody in the state. He's a certified fraud examiner, a certified economic crime forensic examiner. You can read all this. He's got lots of credentials. Also a post officer and instructor. He's testified as an expert witness in white collar drug and computer crimes. I think most Anna and I have as well. Not always fun going to court. But he certainly has investigated and prosecuted hundreds of fraud cases. So if you've got a fraud case, then David's certainly a good resource for you. He's a facilitator of the Financial Exploitation Work Group, member of the Metropole Fraud Group, and then also his, obviously, his interest is financial crimes. So he does the At-Risk Adult Crime Tactics Certification course, he does REACT mandated reporting, and then specialized presentations by request. Again, all of us, technical assistance as requested. Most of his come from prosecutors, law enforcement, APS, work groups, financial exploitation, the A&E work group, and legislative work group. Technical assistance, anything involving financial exploitation and abuse. And then these are just some of the presentations, trainings, prevention, investigation of financial abuse. He's part of, there's a 3-day financial crimes course down at the Georgia Public Safety Training, so he's one of the instructors for that, and then also ACT certification. Anna, also post-certified officer and instructor. She was in the Forsyth County DA's office and also in the Hall County. And I can't remember, I think it was Forsyth was where she was the investigator, and Hall County was where she was the victim advocate. And so her areas of interest are the MDTs, again, supporting and working with them, and then also human trafficking. She's on the statewide human trafficking work group, and one of the subgroups is vulnerable adults. So she trains in ACT and REACT, and then also the Criminal Justice Coordinating Council, CJCC, has a Victim Advocate Academy. That's training for the victim advocates that are in prosecutors' offices. So Anna's involved in doing training for them. Again, with like the rest of us, technical assistance as requested, work groups, human trafficking, the National Network of State Elder Justice Coalitions. They just met yesterday, which is probably going to be an evolution of our statewide A&E work group. And then she's also on the Criminal Justice Coordinating Council Steering Committee, just to kind of remind them on a regular basis that elder adults and adults with disabilities also, have the same type of needs as victims of crime. So these are some of the MDTs that are established: Cobb, Cherokee, DeKalb, Rockdale, and Southern Judicial. Douglas and Fulton County are interested. We've been trying to get one at Fulton County forever, so we're excited about all of it, especially in Fulton County. And then right now, informally, Hart, Franklin, and Floyd are doing some, I think it might be just law enforcement getting together once a month for lunch. So instead of just raise your hands, well, never mind, I'll skip that one because that would require conversation. So Shawanda, again, 20 years in the social work profession. She was a forensic liaison specialist now with us. She was an investigator with Child Protective Services and with APS before being promoted to lead worker in Child Protective Services, and then also to supervisor here with the Division of Aging and Adult Protective Services. She's a certified ACT specialist, and then also has been certified through NAPSA with the training that they provide. Her areas of interest is just aging and disabled population, identifying and improving system gaps, and training. And she's a very good trainer. So she's a liaison, improve communication with community partners, identify policy practice issues, providing referrals for services, attend APS PGO's meetings. She does a lot of training already with APS and PGO hospital social workers. She's been calling and going around the state, talking to social workers. She assists regularly with ACT and with REACT, and then specialized presentations as requested. And technical assistance has requested as well. And she's got the best attitude. I love being around Shawanda. She probably doesn't like being around me, but anyway, as a resource, technical assistance, cases involving abuse, neglect, exploitation. For presentations, she likes doing things on prevention and investigation of financial abuse, which is great. You know, let's try to prevent it before it even happens. General abuse, neglect, exploitation. Again, assist with ACT and REACT. I was thinking I had to be through at 2, but I've still got a few more minutes and one more slide. So for us, for the future, when I was meeting with the officer last week, one of the detectives, what they were telling me was that the issues that they encounter with responding officers is they're just training issues. When an officer responds to the emergency room and there's, you know, it's possible neglect, it's possible abuse, then wherever that person just came from, whether it's a facility, whether it's their home, wherever they just came from, you have a possible crime scene. You need to get somebody to that location. And that was not done in a recent case, and it's something that I've seen in several cases. So that's a training issue. So we've been asked to put together training that's just for responding officers. Like, what do you do when you first show up? And it's probably going to be about a 2 or 3 hour course. And so that's one of the things that we're looking at right now. And we've got 3 classes pending. I've just got to review them today that we're going to try to get up online through the Georgia, through GPSTIC, the Georgia Public Safety Training Unit, because it's open to everybody. Anybody can access the training, but it's going to be 3 hours of just basic abuse, neglect, exploitation. And so moving forward, what we want to do with the task force is to expand the outreach to public safety, public health, because abuse of older adults and adults with disabilities, the results for the individuals that are the recipients of the abuse, neglect, exploitation is clearly a public health issue. And then also expanding our reach into healthcare, which I just did a training for interns, ER interns, nurses who are going to be working in the ERs at Northside Hospital. And so other people that, you know, have been working in the ERs for a long time said, we need this training for our regular staff. So I'm working on that now, trying to get in to do training for just staff. We want to partner with, you know, various departments and agencies, just continue to do that, especially those that are providing victim services. Identify advanced abuse, neglect, exploitation training topics that we might not just cover in ACT. And sometimes we're sort of just hitting on the highlights. We're going to do a deep dive maybe into sexual assault, strangulation, trafficking, you know, whatever the latest exploitation trends are, et cetera. And then just to continue to identify and address systems gaps. So in a nutshell, that's kind of what we do. We definitely would like to hear from you if you do, you know, have needs, if you have something that we can be of assistance with you or for you or in your case or whatever it is that you're looking at. We'd love to hear from you. So this is contact for all of us. We have just sort of, if you have a general inquiry, you can just send it to the FSIU at dhs.ga.gov, or if you have a specific question for one of us, you can send it to any of us. And that's all I've got.
Pat, I'm not sure if it's clear what benefits trafficking was. I wonder if you could just take a minute and explain that. And if anybody else has questions, get ready to ask them.
Okay, sure. Benefits trafficking is just a hybrid of human trafficking. Everybody's probably pretty familiar with human trafficking. And it's basically when people, individuals, are specifically targeting older adults and adults with disabilities, and they'll use coercion, you know, they'll just flat out lie to them. They'll do lots of different things to try to sort of get the person to come stay with them. And then once they sort of have control of the individual, usually what we see is they'll have a joint, they create a joint bank account, and the direct deposit of that person's Social Security will go into this joint account. And they'll usually take food stamps. If the person had food stamps, they're going to take their cards. They're going to basically do anything and everything they can to exploit that individual's monthly benefits. That's why we call it benefits trafficking. But at the same time, when they've got control of these individuals, they also will engage in identity theft. So a lot of times the rent, the utilities, everything is in the name of the residents, unbeknownst to the residents. And so it makes it hard sometimes to track the bad guys, because none of the none of the rent, none of the utilities, none of that is in the suspect's name. It's always or it's often in the names of the residents. But it's definitely a crime, and as of 2018, it's a felony to engage in that. And so we sort of copied the federal language a bit. So we're hoping at some point the federal language will, they can do a subsection or something of the current federal statute so that we can then be getting some funding as well to serve this special population. How's that? That's benefits trafficking in a nutshell. But I mean, it's pretty devastating. Imagine if you're living at your house, you're doing your thing, and suddenly 40 people show up at your front door and go, oh, by the way, it's moving day. And so that's sort of the way the impact it has on the residents through no fault of theirs. And then trying to find a safe harbor for them while we sort of figure out, what needs to be done, try to get them back in touch with it, get their Social Security back to them, get their food stamps back to them. A lot of times it might be, oh, by the way, you can't bring any of your own belongings because everything you have is infested with bed bugs, and we can't risk, infesting the next place. So that's why the TERF, the temporary emergency relocation funding, is so important. Try to take care of those things during that interim period.